We're now in the doc zone. It's the part of the body that tends to take a daily beating, our feet and ankles. So minor aches and pains can be common, and not just in athletes and older folks, which can cause some confusion about when you should take the first step to see a doctor. Doctors Cory and Parisa Morris from OrthoArizona are here to clear up the confusion. Thanks for joining me this morning.
Thanks for having us.
So let's talk about what are some of the injuries that you're seeing right now, so more seasonal. What would you say those are, Dr. Morris?
Well, yeah, as the weather's been getting better, people have been getting outside more, so we're seeing a lot of people getting ready for marathon season, running. So I'd say the most common things right now, we're seeing a lot of heel pain, we're seeing a lot of tendonitis, and stress fractures.
Now, while I say this is seasonal, Dr. Cory, it could be a year-round thing with athletes because overuse.
Particularly in Arizona and other warm weather states, a lot of the children and even most of the states tend to train 11 to 12 months out of the year. And so that being said, there's a lot of overtraining, a lot less time for rest and recovery, and therefore all of these issues become more apparent in this subset of patients, meaning athletes.
So Dr. Cory, what would you say would be some of the treatments that you would recommend before they go down the surgery route?
A lot of times they lose track of listening to their own body. They're coached, particularly with the athletes, and even the recreational athlete, the people that are training for marathons or their first running experience, be it a half marathon or a 10K, are often coached by their fitness instructors. You know what, you got to work through the pain and those things. And that's good because they're uncomfortable doing something new, but they have to learn when that pain becomes something that is no longer a good pain, but it now becomes an actual detriment to them. And that's what we're here to help educate with. And when it becomes a progressive issue, day after day pain, the pain increases, can't seem to get rid of it with simple things like rest, ice, anti-inflammatories. Now we're beginning to get into a physical ailment that may need attention.
So when you go down that surgery route, we had talked a little bit about sometimes people want to get back in the game, but you need to heal properly. Is that correct, Dr. Morris?
Absolutely. You know, these things probably didn't happen quickly. They're going to take time to heal. And whether we're doing non-operative or operative treatment, you need to give your body the right time to heal. And so that does mean, unfortunately, sometimes taking back a step from the athletic activity.
So there's one thing I hear a lot about, and that's bunions. We're moving on to another issue that you guys might face. So tell me a little bit, Dr. Cory, what are bunions, and then what would be some of the treatment options?
A bunion is a deformity of the big toe area, particularly at what most people would call the first knuckle. And more often than not, the big toe tends to angle towards the smaller toes. And in addition, there's a large bump along the inside of the shoe inside of the foot that often creates pain when they wear shoes, more often than not.
So when it becomes a problem where it's daily pain, that's when they could come see you too.
Absolutely. Well, first I want to talk to my patients about shoe wear, what's causing the pain, when are they having pain? Because a lot of these things can be resolved by changing shoe wear and some simple modifications. But when that's not going to work, that's when you need surgery. And bunion surgery is not easy surgery. It takes a lot of recovery time also, and so you need to be ready for that.
So what could that recovery time be?
Depending on how complex the bunion is, and people have the concept that a bunion is a bunion. And there are in our literature at least 125 to 150 different surgeries described to correct bunions. It's actually a multifactorial deformity and can be progressive over time. And so it's not simple to say, but at a minimum you're looking at 6 weeks.
So there is no shortcut to any type of foot or ankle surgery, is there?
No.
Sometimes people hear of things that could be shortcuts, and that's not the best route to go. Is that, Dr. Morris?
No. I mean, usually if it sounds too good to be true, it is. And so you'll hear things that, you know, can be treated quickly, simply, in no time. That's typically not going to work out.
So how do you educate your patients or viewers who are watching right now?
I try to tend to stay with the scientific data. If you can show well-studied patterns of scientific method, then we can at least present statistical data that shows our procedures hold up over time, are tried and true, and have outcomes at this particular level. A lot of these fly-by-night treatments that promise great relief with no real investment have no science behind them.
All right, well, I think this is great information for our viewers. I would like to thank the doctors from OrthoArizona for being with us in the Doc Zone. Join us each week as we tackle new topics on joint health.